we have a suture removal kit? Okay, right there. So I have my suture removal kit. Okay, I need to have my 2x2 or 4x4. Okay, and then my ChloraPrep, and then my sterile dressing. Okay, same procedure. Okay, clean gloves. Okay, remove it with your clean gloves, like when we started the central line dressing kit. So once it's removed, let's say we already removed it.
That's the one that we apply pressure for like 5 minutes? Or?
Yeah, it depends. Yeah, on your platelets and your coag. Save this one because you're gonna use that one for practice. Okay, so we removed it already, and now we're gonna wash hands, then gloves. You have your sterile gloves on. Okay. Make sure before you wear your sterile gloves, same thing when changing a dressing. Okay, you need to open all the kit that you need. Okay, your scissors, your suture removal kit, and then open this one. You can just put it here. Okay, your chlorhexidine, and then wash hands, then gloves. Let's say I have my gloves on. On your CPE, okay, your dominant hand, okay, that's the one that's gonna hold the scissors. Okay, because I mean you're gonna have a hard time to cut your suture if you're holding it on your non-dominant hand. Same thing. This is the one that you need to keep it sterile, and this is one is clean. Okay, so you hold it from there. You have your sterile gloves. You get your scissors because it has a suture. It depends on the order. If the order says, you know, send the culture for central line, send the tip for central line culture, okay, then that will be the time that you need to get a specimen bottle, okay? Just in case that you have an order for that, so make sure, because you're just going to do this by yourself, okay? So same thing, before you do that, you open this one, you open the bottle, or where you're going to put your specimen, the tip of the catheter, you open it, prepare it here, you wash your hands, your dan gloves, and then from there, okay, this is going to be my clean, and this is going to be my sterile, okay? So remove the sutures, okay, you remove the sutures, and then before putting it out, remove the, you know, if there's any excess suture on the skin, remove it, okay? And then clean the site. So once you clean the site, you tell the patient that you're going to pull out the catheter, take a big deep breath when we pull it, and then hold it, okay? So as the patient, do a return demonstration. You can do that, you know, as a pre-teaching, or make sure you do that before opening your, or removing your central line catheter. And now, since this is still sterile, right, I can get my 4x4 or 2x2, okay, and then put it here, and then ask the patient take a big deep breath, and then hold it. While they're holding their breath, you have to remove the catheter. I cannot remove it because it's stuck right there. And then once it's removed, okay, tell the patient that they can breathe now, and then put pressure, check for the intactness of the catheter, and then once it's not bleeding, then that will be the time that you need to get another 2x2 and then cover it. Okay? So if you're gonna send the catheter for culture, so this is still sterile, okay? It's not in here. Okay, let's just pretend. Okay. Let's say this is the tip of the catheter. Okay, I'm holding it with my non-dominant hands. Okay, I already pulled it out, okay? And you already opened the specimen bottle, right? Because you don't have time to open, or else once you touch that one, it's considered unsterile. So once you pull it out, okay, make sure that you have a CNA to, you know, put pressure, or else, you know, your patient will bleed to death. Or if you're just by yourself, what you can do is you know, you put pressure, and then, this is your sterile gloves, right? So once you pull it out and then hold it from there, okay, because this is still gonna be sterile, and then put pressure. You can stay there for 5 minutes, and then once you're done, you check. If it's not bleeding, it means it's not bleeding anymore. If it's not bleeding, then you hold it and then cut it, okay? And then make sure that you cover it once you're done, if you're just by yourself.
Why do we have to cut it?
Because you're gonna send it for culture.
Oh, okay.
Because you don't wanna cut it, you don't wanna send everything here, because this is what? This is contaminated, because this is exposed to the, that's why we have to cut it. Make sure we cut it, that's why usually they order sanded tip for culture and sensitivity. Okay? I'm sorry? Yeah, only if it's ordered. Okay, like, for example, the WBC went up, and then you need to send a culture for, a tip for culture and sensitivity.
To see if
Okay.
that's why the WCs went up.
Mhm. Mhm.
To see if the WCs went up because of the tip of the capsule.
Mhm. Yeah, if the infection is coming from there. Okay, so question? Okay, so everybody will have time to practice. You can use that mannequin and this one.